Public health experts are sounding alarms about H5N1, also known as bird flu, as reports that there is now a proven case of transmission from animals to humans. A Texas farmer became infected recently, and experts say that he caught it from a cow, not a bird. This has sparked the Centers for Disease Control and Prevention to request that local and state health officials Tuesday stay on top of monitoring flu outbreaks over the summer, particularly any human-to-human spread of the H5N1 bird flu virus.
Usually, flu surveillance is kept at lower levels in the summer because transmission rates are less in warm weather. But the first ever mammal-to-human bird flu case is setting off alarm bells. Fueling the concern are reports showing nearly 20% of commercial milk is contaminated with traces of it. Consumers may be spooked, but the Food and Drug Administration has tried to tamp down people's worries. Maintaining the risk of contracting bird flu from the milk supply is low. Here to unpack more on this is Dr. Scott Roberts, infectious disease specialist and assistant professor at Yale School of Medicine. Thank you for joining us, doctor.
Absolutely. Thanks for having me.
All right, so first and foremost, the idea that 20% of the milk supply might be contaminated in some way, but people should not panic. Help us not to panic, doctor, because I'm a non-dairy girly, but I'm a little concerned.
Yeah, that's a great question. I think the statistic in itself is alarming, but the good news is that what they're detecting is not live virus, and it's called a PCR test, which tests for any viral byproducts. So most likely it's dead virus or very old virus remnants that ultimately did make it to the milk supply. We now know that in actual milk supply that has been pasteurized, they're not able to culture a live virus. And where they're finding this is either in raw milk or in milk where it's dead. So I think the risk from having any animal products, whether it's milk or eggs, as long as they're appropriately cooked or pasteurized, I really see no risk to individual consumers.
But eggs are frequently consumed under, most people are trying to boil their eggs or scramble their eggs hard these days. That almost is even more concerning. What is the risk factor with respect to the egg supply?
Even with eggs, the risk is still pretty low. I always advise patients, if you want to be safe, make sure that your food is always cooked to an appropriate temperature. And that includes beef as well. We're seeing this outbreak that currently is occurring in cows in many different states and many herds that have been infected. And they haven't really found virus that has been in raw beef that's been able to survive once it is cooked. And so I know people love to consume raw foods. I myself do as well, but I recommend in this current outbreak situation that really we all take precautions and cook our food as best we can.
What can you tell us about the person who did contract the disease and the circumstances of that?
Yeah, this was a farm worker who was working on a dairy farm with a herd that was known to be infected, and he did present with a mild case of bird flu that was pretty restricted to conjunctivitis. So I think there's good and bad news here. The good news is the patient did quite well. Many prior cases of bird flu that have been reported in the past, it's been very deadly, with up to 50% of people dying who do contract bird flu. But this patient did really well. I think the bad news here is that it did reach humans. And my main two concerns with bird flu is first, the severity of it when it does infect humans. And then second, this is clearly evolving. So we're seeing it jump to new species over time. And now we have more evidence of that with this case of a cow jumping to a human. And so that is concern. I think the good news here is that there's really no evidence of human-to-human spread. So presumably once it does get into a human, that's a dead-end host. And we shouldn't really have too much concern right now for this to spread from human to human once it gets to that individual.
Sure,
so far, there's only been one case, but we're monitoring it closely.
Yeah, I'm sure so many of us, in a post-COVID era think of, and if obviously the exact origins of COVID is still up for debate, but, coming from an animal, a pangolin, a bat, whatever it was, that disease then being so easily able to spread from human to human, alarming when you say, this disease actually in the past has had a very high fatality rate, but then, unlike COVID, not really able to spread so far from human to human. So that's probably the case for many of these viruses. When they do manage to cross over, that doesn't mean they're going to be commonly spread from human to human. It's hard. It's very difficult for the virus to jump from between humans. It can occasionally jump from an animal to a human. Is that what we're dealing with?
Correct. Yeah. The risk right now is really in people who directly work with these infected animals. But once somebody does get infected, I do want to emphasize there is very little, if zero, evidence of human-to-human spread beyond that initial dead-end host of that human infection. So the risk of this developing into a pandemic right now is very low. And I think there are some concerning developments where, now it's in cows. We're finding evidence of this in the food supply, but the risk to the general public is very low right now. And I think were this to evolve to a pandemic strain, we're many, many years away from that. And so hopefully we have ample time to prepare and, get surveillance going, get vaccines ready if that did happen. And that's a big if. This may not evolve in any meaningful way to transmit human to human.
I am reflecting on other sort of avian flu outbreak scares over the last, couple of decades. And it does seem like there's a little bit of a mismatch between, at least how it's been presented in the United States, of the kind of death toll that we've experienced here, or, even transmission rates that we've experienced here, and the kind of news focus on the avian flu. Especially in the wake of COVID, where we had, millions of deaths, obviously. It does, when you look and say, oh, okay, there's been, it looks like, just hundreds of deaths from avian flu since 2013, according to, a quick search. Is this kind of a hysteria that people should feel kind of confident ignoring? Or should people start to change their consumption habits and say, I'm going to make really terrible, hard scrambled eggs for the next few months because there's a real danger here?
I think the danger is pretty low in the short term. And where we need to be thinking is more long term if this virus continues to mutate and evolve over time. And right now, I think, even if it did reach the food supply and we ingested it, it's still unclear. Can you get bird flu from eating? Does it have to be exposure to infected animals themselves? And so I think there's a lot of unanswered questions we have. The USDA certainly does believe that the risk from acquiring virus through food products is very low. And I think it is a worrisome stat that we detected it in some food. Up to 1/5 of milk supply has been positive, but that's not been live virus. And it more reflects the fact that it's spreading amongst cows. And maybe the milk is the best way we can monitor how outbreaks are going on in cow herds across the United States. I think you're right where, there's been a couple hundred cases. Certainly this is nowhere near the level it has been with COVID. But I think a concern I have is that one lesson we learned from COVID is what happens in one part of the world does not stay in one part of the world. And so unless other countries really get on board with monitoring and surveillance and taking these bird flu precautions, I worry will it spread elsewhere and continue to evolve and ultimately evolve to the point where it can spread human-human or reach other animals such as pigs, where we know they're mixing vessels for flu viruses and really give that chance of that flu virus to continue to evolve.
And to be clear, the milk you're saying is not harmful, it is not as worrisome, despite the virus being present in 20% of samples, because the pasteurization kills it and it's only raw milk that really presents a threat. That's what's going on there?
Correct. You're exactly right. What they're finding in the 20% is probably just dead virus or small viral particles that had no chance of being alive and causing infection. It has since been found that pasteurization kills the virus. So any pasteurized milk or food product, I would have no concern consuming. And I think they are very, very safe. The concern we have is more raw products where, even then the risk is pretty low to get an infection, if it's even possible at all.
Because you don't know that it's possible to infect yourself via consuming the even a live virus in that format. Is that what you're saying?
Exactly. Yeah. Even that we don't know. There's many questions, and it's much more likely to be infected through respiratory secretions, and ingesting something in many viruses kills the virus in itself. So even that we don't really know, but it's really, I wouldn't advise anybody to have raw products at this point, just out of precautionary measures. But I think the risk is low, and certainly a cooked product, whether it's pasteurized or raw meat that's been cooked to adequate temperatures, there's no risk of acquiring bird flu in that manner.
And are they testing eggs the same way they've been testing milk? I'm sorry, I obviously have a preoccupation as someone who doesn't drink milk anyway, but who eats a lot of eggs. And does not want to hard scramble my eggs. I have all of these questions. I'm so sorry. That relate to how much the egg supply has actually been tested as well.
Yeah, I mean, they are certainly testing this. And if you recall, maybe it was a year or two ago, there were egg shortages. And some of that was due to the fact that many herds were getting infected. And they actually give incentives to farmers where they do find infected bird flocks to kill off the flocks and reimburse them financially. So they do have an incentive to find where there's infected chickens, kill off the herds if they are found to have products. So we really hope that the eggs that reach the consumer are safe. I should say, to your point of very densely cooked scrambled eggs. They did this recent study with raw beef where they cooked it at various temperatures, and they found that all the virus was killed at medium to medium well temperatures. And even when it was raw or pretty rare meat, they found much less virus than it would have been if it was actually raw. So even though the eggs aren't fully cooked, the hope is that enough of the virus would be cooked that there would be a very low risk of infection to begin with.
All right, steak tartare and omelets for me tonight.
Thank you so much, Doctor, for joining us.
Consumers.
We appreciate it. Thank you.
Thank you.